what CORDS has built is trust and confidence between different experts in different regions. So that allows to respond very quickly when an alert is given in one region. You can receive the support from the other regions.
CORDS is the only organization that is focused on the last mile and on the first mile, and then everything in between. That's why we support CORDS. We are proud to be associated with CORDS, which has had so much success.
Mobile phone is everywhere. How can we connect them? Detect it right at the spot, prevent it, detect it, and respond immediately to limit the outbreak before it spread. And that's how we can end pandemic.
Then by countries working together through regional networks like CORDS, we can not only increase that regional health security, but by connecting those different regions of the world together, we will assure global health security.
From the FAO perspective, I think it's very important to have networks at the regional and the local level. I think establishing this network will increase the capacities of countries and how they can share information and can act at the regional level before these problems become global issues.
I think where it's really important for us to have collaborations with groups like CORDS is around the surveillance of human health as well. Traditionally, human health surveillance has been based out of medical facilities such as local clinics or hospitals, and sometimes it takes a little bit more time for us to identify an event. But community-based surveillance can detect both human health issues and animal health issues at the same time. And as my colleague mentioned, we can really speed up the detection of problems and try and investigate and respond as soon as possible.
We are aware that how critical this is to have this communication between different networks in different regions, and that they try to use as much as possible similar methodologies, or at least comparable.
Infectious disease success and impact in the region will depend on its capacity to harness those networks. We do not intend to create new networks, but we intend to strengthen existing networks and make them more, coordinate their activities, communicate more and collaborate more, what I call the 3 C's. Okay, the communication, coordination, and collaboration.
Today, CORDS networks regularly meet to exchange information and innovations, participate in training courses, learn through joint investigations and case studies, and jointly build surveillance capacity. You will hear a lot about their great work and successful collaborations over the next 2 days. I think you will agree that we've come a long way.
We can enhance that global health security by filling the gaps in between.
In the middle also I put the activism that Christophe mentioned. Because without the activists, ourselves, the scientists, we will never have been succeed in implementing, in increasing the access to the antiretroviral treatment for people.
One of our specialties is cross-border activities. We have activities at the borders because we know that in this region, our people were actually superficially divided. So they're the same people and they are always moving across. And because of that, the exchange of diseases at the border region is actually very high.
When we joined CORDS, we found that CORDS could help us in communicating with other regions, because as we know that emerging infectious disease is considered as a disease without border. So what happened in other parts of the world could be in our region within a very short time.
So the network is a complexity of interactions in the Southeast European region. So there is a multi-country, multi-level, multi-player.
MBDS is the pioneer of the cross-border information sharing and the collaboration in the region, and they're based on friendship, trust, and mutual understanding. This is very important for the network collaboration.
Many people don't know the importance of networking. So there is a need that people should be educated, should come out, so that they come out, they give information, which will help to consolidate the effort, which will make the world one health.
That was the first confirmed case of animal-to-human avian flu in Thailand. The H5N1 virus is primarily a disease of chickens and ducks. It passes to humans only rarely, but is often deadly. The big concern is that a new strain will emerge that passes easily and directly from one person to another. If you live in a city, you probably come into contact with dozens of people a day. If one of them has a highly infectious disease, it can easily be passed on to you. With avian flu, early detection is crucial. Regional networks like the Mekong Basin Disease Surveillance provide a hugely important service.
Collaboration and sharing of information is very important in this part of the world. And we realize that no single sector can deal with the disease. That's why collaboration with other sectors like human health, animal health, and environmental health is very important. It's a bit like an orchestra. An orchestra has to work together to be successful. We are no different. We practice, we try to improve so we can work together more effectively. It's all about trust.
The sharing of timely information saves lives, and that's what makes networks like MBDS and others so valuable. They connect professionals from neighboring countries across human, animal, and environmental sectors, and it's been hugely effective. But with millions of people traversing the globe every day, it's no longer enough to have surveillance networks and cross-sector dialogue between countries. We need them across continents. So agencies take regional networks like MBDS and others and connect them on a global scale. Back in 2003, we had very little understanding of avian flu and how it affected humans. But through our experience investing in research, capacity building, and partnerships, we've come a long way. Public awareness is now very high. Our people are better trained, and we have greater capacity and surveillance. Together, we're enabling more trust, better coordination, and greater resilience against infectious diseases.
If an outbreak were to happen again in Thailand, I am confident the outcome would be significantly more favorable.
We have brought all of these sectors together. We call it One Health.
The deadliest Ebola epidemic ever witnessed has engulfed West Africa.
We are definitely in an era of increased risk for infectious disease.
For the first time in over 40 years, the world appears to be on the brink of a global epidemic of a new flu virus.
Disease surveillance, early warning, and detection is enormously important, and all of us have a stake in it.
MESIDS is the Middle East Consortium on Infectious Disease Surveillance. It's a regional collaboration between Israel, the Palestinian Authority, and Jordan to prevent, detect, and respond to disease outbreaks.
You have to train together, you have to know each other. If you're a public health official, it means you have to communicate, and you have to have equipment that is at least comparable, where you can deal with each other, and you have to have trust.
NTI, in looking at what was being done in the area of early disease surveillance, was very aware that the World Health Organization works bilaterally with countries throughout the world. But what's really missing was encouraging neighbors to work together on public health.
And at the time, the thought was, let's pick the hardest neighboring countries to try this approach, because if we could show that health is sort of a diplomacy tool, in other words, it's the common denominator between those countries, then it's not about regional cooperation, it's about other issues that we can overcome.
And that's the value of these regional networks, because germs, for sure, don't stop at the border.
When MESIDS first started, they started by agreeing to work together on foodborne illnesses. But what we've seen over the past 12 years is that they have been confronted with a wide variety of real-life pandemics.
MESIDS had actually worked on avian influenza and what they would do if it appeared, and so they actually had this joint plan of working together.
The first farm was in Gaza affected, but according to WHO, OIE, you have to cull animals within the distance of 3 kilometers, and within the distance of 3 kilometers it was Israel, and at that time the culling was in both sides, from Israeli side and from Palestinian side.
So we had avian flu, but among the turkeys, among the coops of the turkeys, but it has not reached any one person in the 3 countries, and this is the success.
Then in 2012, the MERS coronavirus emerged within the region.
We had an outbreak in one hospital among healthcare workers working in the intensive care units and cardiac care units in one hospital in Jordan. At that time, we could not diagnose the causative agent of this outbreak.
Later that year, MERS coronavirus was discovered in Saudi Arabia.
When we went back to our specimens that has been preserved at that time, it was the same virus. So since then, we have contacted our colleagues from Palestine and Israel, and we had so many meetings to discuss this case in order not to be transmitted to their countries.
Most recently, there's been heightened concern within the region over a potential outbreak of polio. Some have speculated that the source may be the large number of refugees.
We coordinated all together in order to conduct vaccination campaign in all the area, and we conducted vaccination campaign in Syria, Lebanon, Jordan, Egypt, Israel in the same time. This to create what we called herd immunity in order to fight the virus.
One of the things that I think is truly remarkable and very admirable about MESIDS is the degree to which these public health officials regularly collaborate in the face of very difficult political circumstances.
I think the trust that has been built between these public health officials and the courage that they've displayed in working together in a region filled with animosity, in my view, they're real heroes.
We have to trust each other, Israeli, Palestinian, Jordanian, Egyptian, American, Arabian, all together, because at the end, our common enemy is disease.
I think that the friendship and the collegiality between us is built on this trust.
I hope that MESIDS will be remembered for establishing a solid platform for inter-country cooperation and collaboration, and a platform for peace in our region.
It's vital that we all support MESIDS because it is a shining light of how you can work under political strife with health, which really is what the people deserve.
This program is run under the Southern African Center for Infectious Disease Surveillance, succeeds, and it focuses on the context of One Health. That is bringing together the context of human health, animal health, and the environment.
Had two elements about Africa. One, that it had the highest burden of infectious disease. In contrary to that, also has the least capacity to study those things, to detect them, and to risk manage them.
Diseases are becoming more serious, more harmful than they used to be. The nutrition is a bit on the lower side, so people are being affected.
And we see that in these conditions in Africa, in Tanzania, there is a very big interaction between human, wildlife, and livestock. And diseases are transmitted from animals to humans. We've been working too long in silos, the human side and the animal side. We are in a peripheral hospital, and such hospitals face many challenges in terms of preparedness and response to infectious diseases, especially in case of epidemics or other public health emergencies.
To identify an unusual disease event, we've got a program working on the use of mobile technologies that will enable communities to be able to report. So then that requires high-powered science, which most of that it has been funded by the Wellcome Trust, whereby we are developing capacity for science to the limit of our young scientists. We're trying to get our young scientists not to be limited by what is in their immediate environment. They can tap it in through the virtual center within the region. They can tap it in through our smart partners. It's not sending samples. It's moving with his samples to where the facilities are. That's the beauty of this virtual center. That's the beauty of smart partnership.
There is a call now for strong partnership between the veterinarians and the human health people to work together on all issues and to inform each other. And I think this is very critical for preventing any future epidemics.
The essential element is how to outsmart that pathogen by combining forces across the sectors, by combining the sciences across sectors, but also by integrating the natural sciences with the social sciences, because it's the social sciences which will tell us communities. We are getting to identify the African agenda. What is our problem? Where is it? And then to combine forces in what we call the smart partnership. As African scientists, together analyzing what is the problem, together trying to do research to find a solution. And that research is driven by the best technology to address a problem in our communities.
I'm walking from Kenya to Tanzania, Narok County Council to Ngorongoro District Council. This is a border between the two districts. Animals move from one country to another one, and they go with the disease. Disease don't have borders.
We do have Maasai community living in both sides. They depend on each other for building materials, household appliances, but more importantly, they depend on medicines to treat livestock and humans.
And disease also move from this. Borders are porous, no control measures. And I think it is our work to try and control disease. The best way to do is to develop means and technology to capture disease within these porous borders so that at least we can have an effective control method to prevent disease before they affect their respective communities.
With cross-border, the problem is each country has their own policies. And usually it's not easy for the Kenyan surveillance people to communicate directly to the Tanzanian side before informing their policy makers, and a decision is taken there to inform the other country. And that takes a lot of time. The time then the government takes to inform Tanzania, maybe that disease has already spread in Tanzania and devastating both the community and the government. So how do we communicate quickly and make sure that that communication is not only one-sided, it's not only upwards, it's communicated quickly, but there is a quick response with actions. What I think in the scientific community and what is ethical is actually to be able to engage the community and to engage the field workers in such a way that they can continuously talk to each other, and when there is any information, anything happening on the other side, is communicated between partners, colleagues, and that will save money, that will prevent devastating effect of the economy, and that will also actually help the governments in stopping the negative effect on the market that would have happened because of the delays. By the time then they make a decision, those problems are controlled.
We are getting to identify the African agenda. What is our problem? Where is it? And then to interest those who are at the discovery end of science, to combine forces in what we call the smart partnership. As African scientists, pulling in those who are at the discovery end, together analyzing what is the problem, together trying to do research to find a solution. And that research is driven by the best technology that, in combination with those who are discovering, we can marshal in order to address a problem in our communities.
So there is real need now for a good partnership, collaboration, and fast information relaying between countries with the international community. We know what kind of devastating effect we may have learning from Ebola. And now that we can say the regional community and the international community have learned from Ebola, and we are more intelligent. If we don't do that, then we will not have learned from Ebola. And it will be a shame if something happens and we are taken by surprise again.
I'm here to share our experience from the region Eastern and Southern Africa, where originally Zika is from, was described from the Zika forest in Uganda, which is a country north of Tanzania.
And I am happy to meet with the rest of the experts from all around the world, which I have, some of which I have not met, but many of which I have met in other platforms before. So it's good to reconnect and good to learn about new things as well.
Okay, what do you expect from this meeting, sir?
Yeah, I don't know how to say.
Now, this is something we actually from UCL are going to contribute to the consortium with our pipeline. We have set it up successfully for other viruses, other RNA viruses like influenza, hepatitis C, which is also a flavivirus virus. And we want, and HIV, and we want to offer that to the consortium and answer questions that are relevant to whole genome sequencing.
Submitting that statement, we hope that we could get better support from the government as well as from the donor agency. Thank you.